So we are now at the point of our presentation for the COVID section, the section's COVID team. And so Javier and Susie and I will be presenting on the work that we have been doing under our COVID program grant. So I'm just going to share a little bit about our program goals, which really was to build infrastructure. And you can see the slides, but I'll just speak on them. To build infrastructure for the section in building the leadership and providing training and support for our CHWs so that we could build capacity to also help slow and stop the spread of COVID-19 in our underserved communities. And then to provide training, specific COVID training to our community health workers and support in their self-care and also in making sure that they don't burn out in the work that they're doing. And then also to just build our leadership. So we have had continuous leaders coming in and out of the section, and we've had to start all over every time in building capacity and providing opportunities for CHWs to build capacity. And so a lot of this grant was to help build that infrastructure so that we can move forward to continue providing CHW support to all the CHWs who are across the state, not just working on COVID, but also working with, social determinants of health and also health disparities and health inequities. Next slide. So our first objective is helping to stop the slow and spread of the virus in our communities. We really had to identify what the issues were, what are the gaps. And similar to a lot of the programs that you all are working on, we did a lot of these same things that you see listed on the presentation. We worked on really asking community members, what is it that you need during this time? What is it that you don't understand? What's overwhelming or confusing about the resources that are provided? And we got a lot of the same feedback for a lot of our communities, that it was overwhelming, that the messages and the information that was being sent out was over a lot of people's heads. People weren't understanding what is the difference between COVID and the flu. Is it the same thing? I'm hearing two different things, information being shared with community members. Where do I go for valid information? And so we had to make sure that we understood all of these things in order to provide the best information for our community members. And in doing so, we hired CHWs that represented our different communities so that they could go out and find out this information, come back, and then we could get to work on developing material to share and also direct our community members to those resources. And Susie will talk more about that outreach and education. So the second objective of providing COVID-specific training, we looked at all the information that we collected, the feedback from talking story with other community health workers out there and also community members, and we put together a list of things that were priority for them, which were mental health, schools, what happens in the schools, what happens with sports, what happens with primary care. All of these issues that are listed on the slide came up for community members. And so we tailored our training schedule to make sure that we address all of these questions and concerns that our community members brought to us and our CHWs. We worked side by side with Kevin and Tessa to make sure that they were providing the state updates and what the changes were that the governor was presenting on his live broadcast along with Dr. Dunn. And then we went to work at looking at pooling the expertise of CHWs that we already had on our section and building out training that we could provide for them during our section meetings to help with professional development, with personal development, and also with providing them with the capacity to take information that was valid and the training that they got from the section into their work and into community. So resource connection, we all know, this word is used a lot in the work that we do, and everyone asks a lot of times, like, what is resource connection? What is the difference between what you do and what others do in providing numbers and organizations contact information to community members so that they can get resources that they need. And we all know that the difference is that that warm handoff, the research that we do prior to giving out information to find out whether these resources are still available, what the eligibility process is, where do they park when they get to the resource, who do they ask for when they call the resource, and all of this information it's a lot of work that you do before you connect community members, but we know that it's the most effective way in working with our community members because when you just give them a paper or a phone number or a name, they call. A lot of times they don't call, but when they do call, if at any time they feel frustrated with that call or feel overwhelmed or don't understand because the different barriers that our community faces, they're not going to follow up, or they don't finish the call, they don't call back, and they're not successfully connected to those resources. And so we know that it is important for us to do that research prior to our connecting community members and know what the process is for this. This has been effective across the board, where no matter what setting we work at or or community members we work with. And so that was something that we really focused on in providing resources on the alternate Tuesdays as part of our meetings, so that they could come and really share what that process is and give us a contact name that we could call directly and connect our community members to. So we're grateful for all of you who have been able to attend the resource connection meetings on Tuesday nights and share what you do, how we access resources, and what are the workarounds to help our community get successfully connected. Objective 4, okay, to build section infrastructure. We are providing, this is just some of the data. We haven't collected all of the data that we have on the trainings that were provided. And I'm specifically talking about the trainings because Suzi will give you more information on the outreach and education that we did, but we provided about 16 trainings. Well, we will have provided 16 training sessions since we started in September. Every other Tuesday, we were providing training specifically about COVID updates and any questions that CHWs were bringing to us. And every night we had at least 2 topics that were shared with community health workers. And we also had an opportunity to talk to Dr. Richard Ferguson of Steward Health that could share on a clinical side and answer a lot of the questions that we had, which I'm glad Dr. Dunn got to share a lot of that today. We also focused on building the capacity of our leadership. We all know the potential you all have to lead, and we want to provide that opportunity for you to do that here at the section. We, the opportunities that are that you have to connect, to network, to really learn as you go. There was a lot of fear as we got new leaders into the section to lead, and a lot of them were just like, I don't know what it is I can contribute. Well, today you have seen and you have heard from everyone the value of the work that you do, the value of having a conversation with people and sharing the reality of what our communities face. And so that is the value that you bring to the table. You don't have to worry about your degree or about public speaking or presenting. And actually, the more you do it, the better you get. And so we want to be able to provide these kinds of opportunities for all of you, so that if that is where you want to go, or if you can help to train our CHWs, we want you to, there's a place for you in the section to do that. And that's part of what we are working on in building the infrastructure for the section, so that moving forward, we have leaders who are very aware of what we are trying to do, what the mission is, what our goals are, and they know that this is a learning ground. This is a learning ground for all of us to be a better and bigger voice for our community members. And so we will share the data that we find out after we're done with this. Thank you to Brenda and others that are helping with the surveys. It is important for you on Tuesday nights to take to be a part of the survey and answer those questions about the training topics, so we can improve and bring the training topics that are most relevant to all of you and that you want to receive, and also through supporting the certification that the Department of Health and CHW Coalition are piloting right now. We are so excited that that pilot, Suzi and I were actually a part of that writing team in developing that curriculum, and now it's being offered at Southern Utah University. That's a huge step in progress for us. And so as we continue to work on these efforts, even after December 31st, when the CARE grant is over, we are excited. There's so much more work to be done, and building the section really has been an honor for me, especially because it's been the hub, or our goal was to make it the hub where you all are able to find the support that you need to better do the work that you do in serving our communities. Next slide. Okay, I will turn the time over to Suzi, who will talk more about our outreach and education.
Good afternoon, and thank you, Oreta. That was a great speech. Just a recap, my name is Suzi Akok, and I am currently an outreach and partnership coordinator for the Utah Public Health Association Community Health Workers Session. And today, my role will be talking about the outreach and education. Specifically, in this pandemic right now, I felt like my role is really very important. It's very critical in a sense that I provide assistance to the CHWs who are highly hired, and I wanted to make sure they get the adequate trainings that will help them understand their job well. So together with the job that we do, it's really very important, and we cannot do it alone. We actually need to connect with the partners. And so we do a lot of connections and a lot of collaborations with the partners. And as well as, especially with the pandemic, everybody's learning. We're all learning about the pandemic. So part of my huge role is also that I develop outreach activities, which the CHWs will use outside their communities to educate their communities. Some of the topics that we actually targeted the quarantines, mostly the preventative measures. And we talk about the quarantine and isolations, and we all know these are the terms that are really so difficult to understand. We also connect communities to the resources like the testing locations, and as well as providing the mass resources. My huge role also is that I do provide support to the CHWs, and I'm really super excited that I am actually supervising this group, because as a community member myself, I do really understand the struggles, and I put myself in their shoes and offer the kind of support that they needed as they go out to do the outreach in the communities. So the role of the CHWs, these are actually the people that are so critical in this pandemic. So these are the people that actually go outside in the community. They are the trusted members, and they are really the frontline workers. So their job really in the communities is very important. They act as an advocate in their communities, and this is what they actually do. They still go out and do the outreach in the hardest spot areas. They also provide the education, especially in this COVID, like the preventative measures we talked about before. Those are the things that the community health workers are really doing in the communities. And they also help in these social determinants of health. We have seen during this pandemic broke out from March after now, we have seen a lot of the communities that are going through a lot of housing issues. And so the community health workers really go in there and help them with their housing applications, and also connect them to the resources where they could get assistance with the utilities and food, especially the Utah Food Bank. So community health workers are actually doing that, as well as connecting the communities to have access to their laptops, especially that the kids are at home, and most of the families do not really have access to the computers and all this. This is community health workers going outside and look for those resources and then connect the communities to those resources. And they also provide support to the communities who are actually affected. Like we said, this is a safe place to be in. So they always give the ears to listen to the communities to support them in all the things that they are going through. In this job, actually, our population that we are working with, we kind of break them down into three, but these are the huge populations in the state of Utah, and we are working closely with Hispanic and refugees, African Americans, and Pacific Islanders, and all these population, all the community health workers, all represented all these communities. And so they also came from the same communities. Next. Like you have seen the racial and ethnic group, they actually came from all these places, and majority of them actually speak different languages, as well as the community health workers. So these are few of the languages that the community health workers are using right now in their communities to reach out to them. Arabic, Dinka, this is my native. and of course, some speak English, and Hawaiians, I will not go through the languages, but this is just a kind of different languages that our CHWs are reaching out to their communities. And these are also the languages from the communities that we are targeting. So next slide. Now, how are we doing the outreach? You know, it felt so different, specifically with the COVID. You know, the work of CHWs, they usually go out there in the community, even to pass out the information. But as the COVID hit, it kind of shifted a little bit. But even though it shifted a little bit, it's still the CH goes to the community that are really affected. But mentally now we are using the social media, and those are the platforms that you could see on that picture. So we're using the Facebook, Instagram, and also WhatsApp. It's a phone. It's an app that you could call. And as well as also, like I said before, they still go out to the communities and they just do the the small group gathering. So what are the challenges that our CH are really facing? There's so many challenges that they are really going through when providing the services. So for example, like the eligibility requirements and documentations. So some of the communities that they go to, some of them have the documentation issues, like there are certain programs that require them to have certain documentations. And if they don't have, like CHWs are really limited, there's no way they can provide the services to those families that cannot have the documentations that they're looking for. And sorry, so small. And also some of the communities might be referred to other services that they might not be aware of. Like, for example, this is particularly with the refugees who actually might not know a lot of resources outside there. And if they are connected to a certain organization, they might not even know somebody there. And so connecting them to other resources might be so limited for them. And even though they try to refer them to the services. So, and other limitation too, like when we refer the customer, the clients or the communities to other resources, the CH are also facing the limitation of either even though they give them the resources, they might have a challenge that either a community they refer to or a person they refer to the services might not really confirm that they get the resources, or they might decide not to have the access to those services. So a lot of the time we might not know that they are also receiving. So, and another huge thing that we also felt is the language barrier. Like you have seen already, all these people are coming from a lot of different backgrounds and they are not English speakers. So Language barrier is one of the things that our CH are facing. Like, for example, if one of the CH from Latino community is gonna work in the refugees community, that already is a huge challenge because there are so many languages that are spoken in that community, and somebody from that community might not know. Javier, I'm actually gonna ask you to go back to one of the slides. That one. Sorry, I skipped to talk about the numbers of the people that we reach. Go back to the method and our efforts. So far, since we started our effort in September, in the mid of September to the first week of December, so we have reached out to 1,000, almost nearly 1,500 families that we have provided the COVID education and outreach to them. Also, with the resources, there was a stay connected, stay safe, stay connected, the 211 programs. We have connected 253 families to that programs. The referral to the laptops, we referred 30 families, and we know we might have done more. Like as it was one of the challenges that we couldn't tell whether they get it or not because they don't come back and tell us that they got the services. So that's the slide I wanted to go back. Thank you. I'll turn the time to Javier.
Thank you, Susie. Okay, first of all, I apologize. I couldn't be over there because I'm in quarantine. So we tested positive at home and we are doing what we are supposed to do. We are at home on quarantine. So I would like to tell you, to share with you my name. My name is Javier Augusto Campos Paez. Buenas tardes, good afternoon. And I'm the son of Roque and Luz, the grandson of Nestor and Conchita, Sara and Ramon, and the father of Michelangelo and Francesco. And when I was offered this possibility to work as a membership coordinator, I want to be honest with you, it was a totally new concept for me. Membership is something that I'm not really familiar. And I know that we have CHWs and participants in this conference from different countries. So if I may, I want to define what is a membership. And according to the Merriam-Webster dictionary, membership means the state or status of being a member. So that didn't say anything to me. So I was looking for synonyms on this definition, and I found belonging, community, integration, society, fellowship, association, and group. So after this, I tried to put together, because all this month it has been a learning process, and I'm so grateful for this opportunity. I was working with Janet and Suzi and Oreta, and it has been a great, great learning process for me. So I was thinking like, okay, a membership. Let's see, if I belong to a country club, what kind of benefits will I have? I will be surrounded by professional staff, kind of family atmosphere. I will attend social events, build networking. I will share with people with the same interests, right? Probably family oriented. We will play golf. It will be fun. We will have a social life. I will make new friends and I will have new opportunities. So that clicks, in that moment clicks, and I say, oh, this is what I'm supposed to do. So the Utah Public Health Association, the sections were created during the 2014 annual business meeting. The members approved the creation of professional sections. There are three. The purpose of these sections were to provide an organizational structure for members of similar professional interest to collaborate, to work together, to develop opportunities, and also to provide network of experts. And those experts are sharing the same interest, the information that is helpful for everybody else. So the benefits of being part of the UPH, discount registrations for the conference, regular updates of public health news, opportunities to join the peers in UPH, opportunities networking, training, and then the sections that was created for the CHW, for the community health workers, was created on May 19, 2016. I want to read the mission for this section is to empower community health workers in Utah by recognizing, embracing, and advocating for the impact and value of their work within our diverse communities. And anyone can join the section and participate in our monthly meetings. This is our vision. Our vision is we're well trained in Utah. Community health workers are the cornerstone. Oh, my PowerPoint disappeared. Okay, welcome to technology. Let me see. Can you see my screen now? Can somebody give me thumbs up?
Yes.
Okay, so we
Yes.
vision a Utah where well-trained community health workers are the cornerstone of health and social justice. What are the specific benefits of being part of the section for the community health workers? We have weekly network meetings, and they are related with COVID-19 right now. And the health department is there every single week with us sharing data and giving us updates. Kevin is also there most of the time. And we have monthly meetings also for the CHWs. We have personal development. We search and we share the research. And that we meet with community health workers from other counties. So this is super cool because if I know a family, if I know somebody who's in need in another county, and I know a community health worker in that county, I can call and I can better serve the community in that county. So we are building a registry. We're building names and zip codes and phone numbers where we can all, it's like a directory. Some of you are so young, so probably they don't even know what a directory is, but we will have all the information and it will be available for the community health workers. Now, if you want to belong to the Utah Public Health Association, here's the websites, www.epha.org. When you
Hi,
get in
Tiffany. This is
there,
Kim, the community health worker.
I'm sorry?
I'm good. I'm good. How are you?
And I'm good. Who's this? No, maybe somebody had the mic open. Okay. So after you are in that page, you can click on here. This is a link that I have. Here's my phone number as well. My name is Javier Campos, and this is my phone number. And you can call me at any time if you have questions about how to be part of the section. But it's basically $10 a year. Any person can participate in the community. Anyone can participate and can just enjoy all the benefits of being part of the section. And coming soon, we will have a community-based organization and sustainable membership, individual monthly donations, and base organization as well. And if you want more information about this, please do not hesitate to call me. Again, Javier Campos, 801-856-2734. Our executive leadership right now, Chair Suzi Felch and Susana Alba. Suzi, I apologize. I always struggle saying your last name. Malofil. I will let you say it because I know you are talking after me. And the co-chair Laura Ceron, the treasurer, is vacant at this point, and the secretary is Sarai Dickerson Hernandez. So we have been talking about the whole day about the work of the community health workers, what we do in the community, how important is our role in the community. And now I just want to invite you to be part of the section so you can continue having meetings, networking, and be part of that country club for the community health workers where we can be a family and serve the community. Oreta, this is what we have right now. I don't know if you would like to ask something else. No?
Thank you so much to Javier and to Suzi for sharing that information with you. A lot of it similar work to what you are all doing. So we're grateful for that. This CARES funding that has helped us to just be an extension of the work that you all are doing already. We are coming to a close and we want to have our leadership team if you're ready to close us out on this conference. And before we get to their presentation, I just want to again thank you all for joining us today, and to please join the section. Go to upha.org. And also, if you have any questions about the section, or how you can support or help or join, just let us know. You can also find our information on the website, and we will also share our email and contact information when we share the slides and the recording of this conference. Thank you.